Thank you very much, Chairman, and I'm grateful to you, Les Concula, for selecting this particular matter, because I think it's an issue that's of concern to all members of the House. We're aware, obviously, that the Mental Health Commission has published its report for 2013 today, and we're aware of the particular concerns expressed in that report about the 91 children who were placed in adult mental health facilities in the course of 2013. Now, all of us, I suppose, have experience of the impacts on families and on individual children of the actual requirement to seek this sort of help. We're aware of the inordinate difficulties that families have to experience and contend with, firstly in dealing with the child that has these mental health problems, and secondly in dealing with the system that is not always, one regrets to say, as sympathetic or as proactive as one would wish. But to find that, in addition to all those problems that the individual family has to contend with, that 91 people were placed in completely inappropriate adult settings at a time when it would appear that there were in fact vacancies in the appropriate settings is particularly concerning, because the report indicates to us that while the 2013 provision was a maximum of 48 beds, these 48 beds were not filled at all times, and people were told that there were no beds available, while in fact the beds were available. But the reality was that the CAM service doesn't operate an emergency response, particularly for families who have need of such services over weekend periods. So, Minister, we support the ambition of the government of developing and delivering up to 108, I think it is, beds by 2015. But we have to judge the service on the service that is available today. And all the indications are that even the limited number of 48 beds that are available are not in full-time use and are not accessible by those who need them.
The government has prioritised the reform of our mental health services in line with a vision for change, and is committed in particular to the delivery of more and better quality care in the community. Towards this end, funding of €70 million and 890 posts were provided to develop our community mental health services in 2012 and 2013. In Budget 2014, the government again committed to ring-fence a further €20 million for 250 to 280 posts to be recruited by the end of 2014. This means that despite serious resource pressures overall, funding of €90 million has been made available since 2012, which has been specifically earmarked for new mental health and suicide prevention initiatives. Acute inpatient admission for children and adolescents are prescribed in a vision for change as being to age-appropriate acute inpatient units, which are approved centres registered with the Mental Health Commission. The provision of inpatient beds is an integral component of the range of services required to appropriately meet the needs of young people. Interventions are provided through the community mental health teams in the first instance, and if required, access to the relevant inpatient service is provided. Nationally, inpatient bed capacity has increased from 12 beds in 2007 to 56 at present, with 16 in Dublin, 20 in Cork and 20 in Galway, an increase of almost 400% in 7 years. In 2008, 25% of admissions of children to HSE acute inpatient units were to age-appropriate child and adolescent acute inpatient units. By 2013, Les Concula, this had increased to almost 80% of admissions. Now, Minister Lynch is of the view, and I agree with her, that this is still not acceptable, nor is it in line with Mental Health Commission regulations, which require that all children under 18 should be admitted to age-appropriate acute inpatient facilities, except in exceptional circumstances. I think the deputies will agree that significant progress on this matter is being made. The admission of children and adolescents to age-appropriate child and adolescent mental health services, or CAMS, acute inpatient units, reflects best practice and supports better outcomes for the individual. The HSE sees this as a key priority, and its service plan for 2014 has a specific quality key performance indicator to ensure that the focus remains on meeting that objective. Community child and adolescent mental health teams are the first line of specialist mental health services for children and young people. Community child and adolescent mental health teams provide acute secondary mental health care in the community. The assessment and intervention provided by such teams is determined by the severity and complexity of the presenting problem. In terms of CAMS, the ring-fenced financial allocations I've already outlined have allowed for the provision of an additional 230 posts in 2012 and 2013, of which 80% are in place, with the remainder being recruited. This is proof, in real terms, of this government's commitment to the continued development of our mental health services for children and adolescents. It is in this context that Minister Lynch will examine in detail the report of the Inspectorate of Mental Health Services to determine the scope for further improvements on this issue in the future and to ensure that the HSE can continue to make progress towards achieving the desired best practice as resources permit.
1 minute extra.
Let me say at the very outset that I do accept that progress has been made, and I accept the expertise of my esteemed friend Deputy Neville on the far side in campaigning in this particular area over very many years. But I think, Minister, people's eyes glaze over when they hear the talk of the millions that has been expended in the particular area. What people want to see is tangible improvements. What they want to see is that a situation developing where their adolescent child can find a centre to be cared for in circumstances that have become so difficult and so traumatic for the family that it cannot happen, and that care cannot be given at home in order to ensure, indeed, the safety of the child and to ensure the safety of the family. Now, we went, all of us in this House, before the Irish people in the referendum on children, and we said that the rights of children have to take centre stage. I would love, Minister, that you would give us today a commitment that for 2014, no child, nobody under the age of 18 will be committed by CAMS or any other state institution to an institution that is not age appropriate.
Come on.
I just point out, perhaps for the information of the House, that, and I understand Deputy Fearghaíl's point that sometimes people's eyes do glaze over when figures are given and numbers are given, but behind those figures, in fact, lies, I would suggest to the House, a very, very considerable improvement in the real human situation and the actual experience in respect to people who need the services. So, for example, where more staff are provided and where more resources are provided, even though we describe them to the House in terms of numbers, behind the provision of those extra staff and extra resources actually lies considerable improvement in how the service is received by the people who need it. But I do accept that what Deputy Fearghaíl has said in respect of the objective of ensuring that no child under 18 should be admitted other than to an age-appropriate acute inpatient facility, except perhaps in what are described as very exceptional circumstances. That absolutely is the objective that Minister Lynch is very, very committed to achieving. And Deputy Neville also makes the point about the actual use of funds, and he understands this very well. And I know that he's right in saying that the people who are actually in the services, who know the services, their views should always be taken into account and should be implemented as far as possible. I was going to say that something of the order of 17,000 Irish children are availing of CAMS, and in respect of the urgency of the demand, all community teams screen children and adolescents refer to their service on the basis of the urgency of the need. Children and adolescents in need of an urgent appointment are seen as a high priority, as one would expect, while those with a lower acuity need may, in some circumstances, have to wait longer. But I accept what's said about the configuration of services, the importance of emergency services, and I'll communicate everything that's been said by the deputies to Minister Lynch, who's very, very engaged with this issue and has herself made very, very considerable progress in relation to it.